Let me guess, your baby was sleeping beautifully, and then suddenly, chaos. You Googled it, you found 17 different sleep regressions that perfectly match your baby's age. But here's what the sleep industry doesn't want you to know. Most of these regressions aren't real developmental terms. They're just made up marketing terms designed to sell you solutions to normal baby behavior. I'm Jen, nurse practitioner, IBCLC, and today we're going to separate real developmental sleep changes from manufactured parent anxiety. Stay tuned. Before we dive in, let me be clear about something. Your baby's sleep disruption is real, even if the regression label isn't accurate, but understanding what's actually happening helps you to respond appropriately instead of falling into anxiety spirals. What we'll cover today, the one regression that's actually a real developmental change, what's really happening during other supposed regression periods, how illness, teething, and growth spurts actually affect sleep, and sleep evidence strategies to support your family through all the disruptions. If your baby's sleep changes are severe, persistent, or concerning, always check with your pediatrician. Some sleep disruptions are signals that there is a real medical issue behind it. Let's start with the one regression that actually is real, permanent, and a developmental change, the 4-month sleep maturation. What actually happens at 4 months is amazing. A baby's sleep cycle matures from a newborn 2-stage sleep to an adult 4-stage sleep pattern. The sleep cycles shorten from 60 minutes to just 45-minute cycles. Babies develop more frequent, brief awakenings between these cycles, and deep sleep periods become shorter and lighter. What does that mean for you? The research behind it with EEG studies show that there's a distinct brainwave pattern change between the 3 and 5-month periods. The sleep's architecture becomes more complex and adult-like. Changes are neurologically driven, not behavioral, and it occurs regardless of previous sleep patterns or interventions. You could have had the perfect baby before they hit that 4-month regression or development phase, and now they're waking up every 45 minutes crying and trying to have you put them to sleep. The evidence check on this, 5 out of 5 stars. It is well documented and researched, and it is proven. The things that we experience in parents when we have a 4-month-old, you have a previously good sleeper, and then they start waking up more frequently. Your baby might need more help connecting those sleep cycles. Naps become shorter and more challenging, and they often coincide with increased alertness during awake periods. So then you're battling FOMO at the same time. What sets this stage apart from the other ones? It's permanent. The brain doesn't go backwards. It is universal. It happens to all babies, no matter what. It's neurologically driven, not environmental or behavioral, and it's well documented in sleep research. This isn't your baby forgetting how to sleep. It's their brain developing more sophisticated sleep patterns, and some babies adapt easily and others need more support to navigate the new sleep cycles. Now, let's look at these other supposed sleep regressions and their ages and what's going on behind them. The 8-month regression. There is a major gross motor skill development going. They're crawling, they're pulling to stand. There's a lot more separation anxiety. There's increased cognitive awareness. And we get into the possible nap transitions where they're going from 3 naps to 2 naps, and it can be a struggle. In reality, this isn't a sleep regression. It's normal development, but it is affecting sleep temporarily. Then there's the 12-month regression. And what is really happening between that is it's usually naps transitioning from 2 to 1, which changes everyone's schedule. There's a walking development where they don't want to lay down in their crib anymore. They want to stand up and walk through laps, going back and forth in their crib, crying at you. There's a language explosion. They don't want to sleep. They want to talk. They want to learn their babbling skills. And there's increased independence testing. They're going to test those boundaries. At 18 months, the toddler sleep needs are changing again. They have more increased autonomy. They want to test those boundaries even more than the 1-year-old does. Now we're a 1.5 years, and they might be dropping to that final nap, and that becomes an issue. There's more developmental leaps in language and cognition. And then at 24 months, that regression is the typical normal toddler sleep resistance. There's boundaries that are being tested at bedtime. There's fear development if they think there's a monster behind their closet or under their bed. And it's a big kid bed transition. Sometimes we transition those 2-year-olds into their big kid bed and they don't want to stay in their bed when they have an option to get out. The pattern you should notice is these aren't sleep regressions, they're normal developmental patterns, and they temporarily affect the sleep. The sleep disruption is a side effect, not the main event. In research, there's actually very little scientific literature supporting specific regression ages beyond the 4-month period. Most research focuses on developmental milestones that may temporarily disrupt sleep. Let's talk about teething. Teething and sleep are a hard combination. Teething gets blamed for a lot of sleep issues. Teething timeline. You typically will see that first tooth anywhere between 4 months and 7 months. But sometimes that doesn't happen until they're 12 months. There's such a wide range of what's normal for teething. It can throw us off because we think they're teething because they're showing all the signs, and that 4-month sleep regression is there with it. You have to be patient, and until you see that tooth, you never know. The molars happen between 13 months and 19 months. And that coincides with toddler sleep development also, and those sleep challenges. The most active teething months are between 6 months and 24 months. It's a long haul. Evidence check, 2 out of 5 stars. Some effect, but much less than parents think. What actually happens with teething, you'll get the increased drool and mouth discomfort, maybe a slight temperature elevation, but typically not a true fever, increased desire for comfort, and brief appetite changes. Teething does not cause weeks of terrible sleep, does not cause high fevers, does not cause significant behavioral changes, and does not cause long-term sleep pattern disruptions. Parents often blame teething for normal developmental sleep changes because the timing overlaps. This can lead to unnecessary interventions and missed opportunities to address the real sleep issues. Sometimes we just assume a dose of Tylenol and they'll fall asleep, and a lot of times that's not going to do anything for them. Typically with teething, it's brief, 1 to 3 nights as that tooth pops through. Mild improvements with some pain management, like the Tylenol, ibuprofen, a cool washcloth to gnaw on. You'll see those obvious physical signs where those molars are bulging and swollen, or the tooth is visible as it's starting to crown. And typically those kids return to baseline pretty quickly. If teething issues continue on for weeks at a time, something else is going on. You might want to check to have ears assessed, check development progress, things like that. Research on teething and sleep was done in 2016, and they followed 125 children through teething. They did show a mild sleep disruption for 1 to 3 days before the tooth erupted. The sleep returned to baseline once the tooth broke through, and most disruption was minor and brief, and there was no correlation between teething severity and sleep disruption severity. Growth spurts are another common explanation for sleep disruptions. The typical growth spurt timing would be that first week after birth, up to the first 3 weeks after birth. Then we have another growth spurt around 6 weeks, then 3 months, then 4 months, then 6 months. They are frequent, so be patient, and every baby is going to hit them a little bit off of those average timelines. The individual variation is huge, and it really depends on how big those babies want to be on their growth chart themselves, how much milk they're able to take per sitting, and how long they go in between those feedings. Not all babies follow those predictable patterns. The research on growth spurts, there is limited high quality studies on sleep impact because you really can't track it because of the variation. Most evidence is observational and difficult to separate from other developmental changes. What growth spurts might do, they might increase hunger, leading to more frequent night feedings. They have a temporary increase in sleep duration, brief changes in sleep pattern, and increased comfort-seeking behavior. Growth spurt reality check. True growth spurts are brief, typically 3 to 7 days. The main symptom is increased appetite, not a sleep disruption. Sleep changes are usually temporary, and many growth spurts are actually normal feeding pattern variations. If your baby is feeding or sleeping and it's off for more than a week, it's probably not a growth spurt. Look for other causes like schedule changes, environmental factors, developmental leaps, illness, and any sleep association changes. Many babies will have more sleep concerns during illness, and that's going to be a lot more common in those first few months of daycare attendance. So let's cover what illness can do to sleep. You'll notice that babies are more tired when they have a new virus. They want to nap a little bit more. They're more easily to put down initially, but then they'll wake up more frequently due to discomfort, whether it's for fever or an ear infection or a cough. They'll have changes in their feeding patterns, usually smaller, more frequent feedings, and increased need for proximity and comfort. Now, after an illness, there is a temporary sleep change as they have that new habit and that new pattern that they developed while they were sick. So it might take some effort to get back to a positive sleep environment and sleep schedule. So be patient. Know that it's not anything you're doing. Just try to get back onto your routine as fast as possible. Vaccines. Vaccines can disrupt sleep for 24 to 48 hours after vaccination. Usually mild, self-resolving. Usually they're just more tired initially. There may be some discomfort during sleep, and some Tylenol or ibuprofen could help if they were over 6 months. Supporting sleep during an illness is important. You prioritize comfort over sleep training. If you're worried about the cry out method, don't worry about that. Let them sleep, give them the comfort that they need, because sleep is the best medicine. So we don't want to make sleep harder to come by. Expect some temporary setbacks. Return to your routines as fast as possible, but don't make any permanent changes. These illnesses are temporary and you'll get back to it pretty quickly. Most babies return to their previous sleep patterns within a week or two. Gradual return to routines will help more than those abrupt changes. So red flags would be sleep disruption lasting more than 2 weeks, new concerning symptoms like a worsening cough or waking up screaming in the middle of the night where you need to check for an ear infection, significant appetite or behavior changes, and follow your instinct. If you just feel like something's not right, go talk to your pediatrician, have your baby checked out. So there's a new term out there called the Wonder Weeks. And Wonder Weeks is a book that was popularized, and it focused on the developmental leaps, and it gave them week by week transitions for these 10 predictable leaps. Now, they're specific with the timing, and they tell you to expect increased fussiness, sleep disruptions, and improved skills after each leap. The research behind it is pretty limited. There is some evidence for developmental spurts, but it's really hard to get that predictable scheduling just down for every baby. Individual variation is so enormous that it's really hard to really just pinpoint week by week. So there's no strong evidence linking specific weeks to sleep disruption. So the evidence check on that is 1.5 out of 5 stars. It's appealing, but limited research to support it. What we do know about development is that babies do go through periods of rapid skill acquisition, and new skills can temporarily disrupt sleep. Timing is so individualized for each baby, and multiple skills often develop simultaneously. The Wonder Weeks appeal is that it gives parents a framework for understanding your behavior of your baby. It reduces anxiety by providing explanations for those difficult periods. It creates a sense of predictability and control that so many times we as parents want. And it validates your concerns on your observations about baby's development. The problem is that it can create anxiety when baby doesn't match predictable timelines. It can cause parents to dismiss real concerns because it's just a leap, and it oversimplifies a lot of the developmental processes. So my clinical perspective is that you need to focus on your individual baby's patterns, not trying to match predetermined timelines. There's such a wide range of average in there, and real developmental changes do affect sleep, but they're not as predictable as the marketed programs suggest. So what do you do when those sleep disruptions do happen? Here's some tips to get you through week by week as far as what you can kind of control around you and how you can assess the situation. First week, figure out what's going on. How long has this disruption been happening? Are there obvious triggers like an illness or travel or some change in their environment? And is your baby healthy? And what is your family's stress level? Because babies are very intuitive. If you're stressed, babies are stressed. For these temporary disruptions that are under 2 weeks long, first of all, maintain your basic routines, but be flexible with your timing, watching those babies' cues. Provide extra comfort without creating permanent habits that you don't want to stick with. Focus on your daytime stability with your schedule and get support for your own rest if things are disrupted all night long. For longer disruptions, which are going on 2+ weeks, find out if an intervention is needed. Consider your environment. Is the room dark, quiet, cool? Do you have a sound machine going on to mask the household noise? Review any sleep associations and habits. Is there a pacifier? Is there rocking? Is there, skin to skin? Are the babies feeding to sleep? And you may need to reestablish those previous routines that were created before this disruption happened. What you don't want to do would be panicking and changing everything immediately. Don't assume that every sleep change is a regression, and you don't want to start multiple interventions simultaneously. And you don't want to ignore the significant changes, hoping that they'll resolve. There could be a medical issue, there could be an illness, there could be some developmental concern that we need to address. During a sleep regression or disruption, remember to support yourself. Get your partner on board to tag team if you need to. Lower your expectations for other things going on in your life during these difficult periods. Remember that it's temporary, so be patient. You want to seek help if those severe disruptions are lasting more than 3 to 4 weeks, if there's a significant impact on your family functioning, and if you have any concerns about baby's health or development. Don't hesitate. There are some red flags that we want to talk about that would warrant a pediatric consult. First of all, sudden dramatic changes in sleep patterns. Sleep disruption with any other concerning symptoms. Regression in previously mastered skills. Significant changes in appetite, behavior, or development. And any sleep disruption following a head injury or significant illness. Difficulty breathing during sleep. Frequent night terrors or unusual behaviors during sleep. Complete inability to settle with comfort. And sleep changes with fever, vomiting, or other illness signs. Some medical conditions can affect sleep, such as reflux or digestive issues, respiratory problems, neurological conditions, metabolic disorders, food allergies or intolerances. When regression could be medical, we usually see sleep disruptions lasting more than 6 weeks. They progressively get worse rather than improving. Some are associated with other developmental concerns as well. And there's a family history of sleep disorders. Follow your gut. Your intuition is usually correct. And documentation helps. If you're keeping sleep logs for a couple weeks, note the patterns, the triggers, what interventions you've tried, track feeding, diaper output, behavior problems. Parents often sense when something isn't right, and if you're concerned, you seek help, even if others dismiss your concerns and worries. Okay, so let's recap what we learned about sleep regressions. First of all, there's only one 4-month sleep regression, which is actually a developmental shift. Everything else is normal. It's developmental and temporary and should go back to normal if a good routine is still established. Most regressions are actually marketing terms designed to sell solutions to normal baby behavior. 3, individual timing varies enormously. Don't stress if your baby doesn't match predictable schedules. Number 4, temporary disruptions are completely normal. Provide support without panicking, typically with a schedule change or an illness or travel. There are so many factors that can play into these little changes that happen. Number 5, real medical issues do affect sleep, so trust your instincts. And 6, focus on your baby's patterns rather than trying to match predetermined timelines. Every baby is different. And if this helped reduce your regression anxiety, hit that subscribe button and like this video, and I'll see you next time.